the ability to engage in conversation with your physician or provider or your patient about what's going on with your body when you talk to them in a medical setting.
I guess like a patient's ability to understand their disease or condition.
Okay.
And so, yeah, I guess I more so think of the pamphlets that we hand out to people about certain conditions, like how much they can actually take away from that and understand.
Knowing what the doctor's talking about, what they're supposed to do.
Yes, there's multiple layers. I mean, one would be literate in the actual literature, knowing all of the data and stats, research, and the research, but also health literacy and being able to communicate with patients and being able to translate your knowledge into
Really being aware of on larger levels what's going on with patient populations, being involved the political ramifications.
I would probably
Never
say,
heard of that term.
for me, health literacy has to do with giving a patient, working with a patient to work towards an understanding of all of the decisions that they can make and you can make as a provider that can either have a positive or negative impact on their health, and then to what degree those decisions will have a greater or lesser positive or greater or lesser negative impact. And being sort of aware of those as a provider and a patient.
I think it's understanding the patient's culture and where they're coming from and how that might influence how they want to be treated in their care and how they understand their own disease.
being able to communicate and effectively practice regardless of background. And
Yours
sort
or the
of
patient?
both. Okay. Both. That those bridges can be crossed.
I think that's a perfect way to put it, because it's not necessarily tailoring medicine based on someone's cultural background, because that can lead to biases and assumptions. So you want to be able to deliver the same efficiency of practice to patients, no matter of differences or similarities in cultural background or any other background.
I would agree. I think splitting it as background is important because I think there's a tendency when you hear that to think about culture as discrete groups, but even within a culture there's a lot of diversity. So I think just saying whatever your background is and whatever the background is of that patient in particular, making sure you can provide them the same care regardless of you might have two people that are within the same sort of quote unquote cultural group, but they still may be very different.
Yeah, they do pretty, we haven't started our clinical training yet, but in the preclinical stuff we have pretty regular conversations about this kind of stuff, especially in the first few months of school, in its first years. Yeah, we practice it with standardized patient actors.
We had to read a book before school started. I think it's the spirit catches you and you fall down. But so I think that was kind of our introduction to it, and then first year we had a bunch of lectures about cultural competency, and we kind of talked about the book more, and our experiences with patients, we had to shadow doctors and just kind of see how they interact with patients, not necessarily what they were saying, but how they were saying.
Not formally, but
I think it has
it's kind of
been
throughout, right?
And they also just train you teaching patients what exactly it is that they're doing and saying it in simpler layman's terms instead of throwing medical terminology in.
I don't think
as
competency
long as you
has
promise.
been a large part of our foundations in clinical medicine curriculum. I think every week, at least in my seminar group, it comes up as related to whatever topic we're discussing, whether it's how you deal with adolescent patients, how you deal with patients from a different religion, different culture, different sexual identity. So we talk about cultural competency a lot. I actually am not as familiar with the term health literacy.
Yeah, same.
I think because we haven't had a lot of patient interaction, and because really what they're focused on, it seems curricularly, is really focusing on the way that we interact with patients, which has more to do, I think, the part that I think is harder to get a grasp of later on is the piece where you just are able to communicate with people no matter where they come from. They're more worried about our ability to do that before we hop in and see real patients than they are, I think, about the knowledge pieces that they know come over time.
Meet your patient where they are and where they come from, and try to put yourself in their shoes and figure out how you can provide treatment and communicate in a way that will address their needs the best.
I think we have a huge responsibility to make sure that our patients understand what we're telling them about their conditions, and I know that a lot of the time, like, those handouts we give, like, are just convoluted and I don't even know what they're saying. So I think it's really important for the physician or for someone to sit down with them and kind of explain what's going on, draw pictures, and all that stuff.